So have you ever thought about the fact that if you look at the expenses for a company, number one is usually employees. Number two is often the raw materials or the cost of goods sold, like metal, wood, plastic, paint, whatever, depending on your industry. And number three is, guess what? Healthcare expenses. If you're a service industry and you don't have a lot of materials you use, in fact, it may be the number two thing. So I really would like to ask you to think about for a second, if you were going to buy a company, would you want to know about the health of the employees? It's your second or third largest expense. And if it goes up dramatically, your profitability is going to go down dramatically. If it goes down, your profitability goes up. Well, I'm Dr. Scott Connard, the Chief Medical Officer of Compass Care Engineering. And I've put out a number of blogs, I hope you've had a chance to look at them, that talk about the 7 numbers that employees need to know. Because I think there may come a day, in maybe as quickly as 3 to 5 years, where a company is going to have to list the health of their employees on their balance sheet. And what do I mean by that? Well, if you look at assets, what are assets? Assets are employees who know their key numbers like cholesterol, blood pressure, their BMI, or their height by their weight. They have had their age and gender appropriate screenings like mammograms, colonoscopies, those key things that help you diagnose and treat cancer early. And they have a lifestyle where they are, relatively speaking, fit and they're not overweight or obese. On the other hand, liabilities are companies, frankly, right now, where 70 or 80% of the people in the company, they don't even know what they are. They don't know if their numbers are good. They don't know if they have cancer. And by the way, I feel fine is the syndrome that people have until cancer has spread throughout their body. So they could very easily have stage 1 or stage 2 cancer and never feel differently. So that's why our healthcare spend today, one of the reasons where it's so high and you're spending so much money, is because on the liability side, you have people who don't know where they are, or they have diseases and they aren't being treated well. They don't have the tools to navigate the system well, and it's costing you a fortune. So I hope that you, in thinking about this differently, will ask the question, how can I improve my company's balance sheet? How can I improve the income statement every month, where we look at revenue minus expenses and that large healthcare expense? How do I get that down? And here at Compass, we help you do that. We give people tools. We support and encourage you with programs like Health Prompt, helping people know where they are, what they need to do, and getting it done at the best possible place by the best possible doctor. If you do that, your balance sheet is going to get healthier and healthier and healthier. And if there is a day when we have to list our employees, their health and well-being on the balance sheet, you'll come out a real winner and looking like a star. So we hope you'll let us support you, and we hope you'll start to think this new and innovative way about your employees. Thank you.